Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Welcome to today's show with Your Health Today with Dr. Solomon. In previous sessions, we spoke about infertility for women, infertility for men, what to do in different scenarios, and what to expect. Now that we finished with infertility, we are moving on to pregnancy and your education about how to keep a safe and healthy pregnancy, what you should do and what you should not do. The first thing about pregnancy, how would you know that you're pregnant? Your menses does not come on that time that it usually comes into. So that is we call amenorrhea. The menses has not come. It's supposed to come and it didn't come. And the next step, as soon as you miss your menses, we advise that you go to a clinic or a health center that has a good ultrasound to see if the pregnancy is inside the uterus or not. Assuming that you already done a pregnancy test at home and it shows the 2 line, that means the pregnancy is already positive. And we said from previous sessions that the pregnancy, the beta HCG that causes those 2 lines on that stripe is happening after 9 days from the migration of that zygote all the way to the uterus. So once the zygote start to make connection with the mother blood by digging, you know, the baby, as when it's very small, we call it a zygote, it starts digging in the wall of the uterus till it reach its blood, because that baby inside the uterus feeds on blood. So it start digging till it reaches the blood, and once it connects to the blood, the beta HCG hormone start to show in the blood. This is now the beginning of the formation, what will later be called a placenta. So the pregnancy test will be positive about 9 to 11 days. So that means 2 weeks after missing your menses, it's supposed to come, let's say, the 1st of the month, and it didn't come. By the 10th to 15th day of missing the menses, the pregnancy test should be showing positive, even before that. Because conception, as we said, is the middle of the cycle at day 14. So the pregnancy test should show positive. The minute the pregnancy test shows positive, the next step you will do is, I want to be sure, is this pregnancy inside the uterus or outside the uterus? And we explain that, and we'll continue to explain that, because I want you out there to avoid ectopic pregnancy, because rupture ectopic pregnancy is not a very good thing to have, especially if it ruptured during the weekend and no surgeries are available. So that will be a disastrous situation. We don't want to get into that. So the minute you see a positive pregnancy test, the next step you will do, go to a clinic or a hospital and do an ultrasound, and make sure you do the ultrasound inside the vagina, endovaginal ultrasound, because the trans ultrasound from the abdomen, from the surface of the skin, will not show as accurate as an endovaginal will show, because at that time the sac will be small. You need to go inside the vagina and look for a pregnancy sac inside the uterus. If the pregnancy sac inside the uterus, we know we have a pregnancy. Now I need to know if this pregnancy is a valid pregnancy, meaning the fetus is there and is good. We will look for something called the fetal pole, meaning we see a baby inside that gestational sac. We measure the gestational sac and we estimate the pregnancy, how old is the pregnancy. Okay, so that is the good scenario. The not very good scenario is we have a positive pregnancy test and we look with the endovaginal ultrasound inside and we do not see a gestational sac. We do not see a pregnancy sac inside the uterus. And that's what we call ectopic pregnancy. So that means the early recognition of ectopic pregnancy, the much easier the outcome or the much easier the procedure that you will take, because at this point, if the pregnancy is less than 6 months, we can easily drop the pregnancy by a couple of injections and that's it. No complication, everything is okay. And we look after this for why we had an ectopic. We avoid the causes of ectopic. And as we explained earlier, the most common cause is infectious. And the most common infection is chlamydia. So what is the advice here? If you are trying to get pregnant, my advice is make sure all infections are checked and if anything positive to be treated. And take folic acid before even trying to get pregnant. That is the advice. So if you're planning pregnancy, do not catch pregnancy on the top of infection. There are 9 tests you're supposed to do. Most important out of all of them is obviously the chlamydia is number 1, toxoplasmosis, because it can cause fetus restriction of growth, meaning the fetus is there, but it will not grow. So, and that can cause fetal demise, or in other words, fetal death. So there are good steps to take and wise steps to take to avoid all complication and unnecessary headache and stress if you want to get pregnant. Now the fertility issue the infertility issue has been taken care of. Now you are fertile, and it takes about 3 months to get you fertile and get you ready for pregnancy. Now once you get pregnant, you have to look out for things to have safe and healthy pregnancy. We advise about what to do in case of ectopic. We advise, the most important advice is early recognition that you are pregnant, early recognition that the fetus is inside the uterus, not outside the uterus. Those are all things when recognized early, even if there is complication as an ectopic, it could easily be managed without any further complication or stress to you. Just a couple of injections and the ectopic pregnancy is gone. Now, if we wait and we ignore and we don't play it safe, the pregnancy will continue to grow to a point where, you know, the uterus is like a balloon, it can expand. The fallopian tube, this is the most common site of ectopic pregnancy, it cannot expand. So as a result, it will get to a certain size, then it cannot take the expansion anymore, and it will burst, and that's what we call rupture, ectopic pregnancy, and the outcome is not very good, especially if you have serious active bleeding, and especially if there's no surgeon available at that hour of rupture. And it happened. If you're in a far village or so, and this happened, then what can you do? No surgeon around, what can you do? So it's much easier to take precaution steps and look out for things to do when you are pregnant, much easier than to face the complication later on. Now you are pregnant. Now let's go to the good scenario. We have a baby inside the uterus. And inside that gestation sac, we see a small baby. We see a neural crest, or what we call an evidence of an existing embryo there, existing baby there. Then we'll follow up, and we said the follow-up is every 4 weeks till 28 weeks. Every 4 weeks you go, assuming that everything is okay. The doctor told you there is no complication. You've done all the prenatal tests. That is chlamydia, syphilis, hepatitis, the toxo, the rubella, 9 tests that you have to do. You've done them all and everything is okay, everything is negative. You are on folic acid, the pregnancy is going fine, you eating well, you're gaining weight every week or every 2 weeks or every 3 weeks. There is a measurement how much weight you're supposed to gain and everything is going fine. Then we make it to the second term, we make it to the third term, baby is delivered, and then we're gonna now tell you, we have to tell you what you should be advised of, what are the things you should be looking for when you are pregnant. We spoken also briefly last time that was not on our side. We spoken about what if the mother is HIV positive? What is the advice you give? Well, if the mother is HIV positive, she's taking her medication, even the CD4 is 700, which is a very high number. She still have to take the medication against HIV. Why? Because we need to prevent transmission of the virus to the baby. So regardless of the CD4 count, all HIV mothers must stay on medication to prevent transmission to the baby. And we've seen a lot of parents that are HIV positive, but the babies are clear. They don't have HIV. Why? Because following of the protocol, no matter how high is your CD4 count, even if you are undetectable, you still have to go on HIV medication, ART, to prevent transmission to that baby. And we've spoken also about hepatitis B positive mom. What should she do? Well, as soon as the baby delivered, the baby will be given something called hepatitis B IgG, which is an antibody against the virus, and the baby will be immediately vaccinated at 0, 1, and 6 months, or whatever protocol of vaccination the health center in that specific country follows. I think those are the very much important things that we look at when you are pregnant.